Okay. I went and got the OnePlus because the S9 is overheating again. So, whatever. I'm going to get a new phone as soon as I possibly can. Okay, part 2. The transplant fellow. She, there wasn't a lot to this one. You know, she was just there to, like, ask about my overall health, to see if I could handle something as intense as a transplant. You know, and she did say, yeah, I could handle it. And I think the nurse that came after also said that. So her job, when they get together to discuss me, I think either the hepatologist or the transplant nurse said it would probably be in a few weeks. But I don't know. She could have been just saying that a few weeks is when the process will be done and they'll be ready to do so. It was a long day. There was a lot. So the fellow comes in while the hepatologist is still kind of there with us, and she was getting ready to leave. She was gonna give us her card, which I have, and she wanted to make sure that I did make a follow-up appointment, which I did. So there's just a lot of questions there. In her notes, she said, like I think I mentioned, she actually said that I am not jaundiced. So, in fact, I can just pull up my chart since I've got the other phone now, and just help myself along and not stumble through it tiredly, because I'm very tired and I just don't feel that great. Not sick exactly, just tired. It was a lot. Yesterday was a lot. Alright. Let me find her. There she is. Okay, view notes. Chronic liver failure secondary to PBC versus NASH. I don't know what that's about. I guess she's saying that my liver, the PBC, turned into NASH. I don't know. I didn't say this. I don't know why this note is in here. She has had symptoms of liver disease that include bleeding easily, diarrhea, that's true, fatigue, yes, jaundice, loss of appetite, pruritus, which is the itch, and weight loss, and no edema. The patient's cirrhosis was first noted a few months ago. She has a history of significant weight loss. Yep. In October 2023, I was noted to have elevated LFTs on labs, and I was started on Ursodiol and were referred to a GI for further workup. That's not quite true, because the GI is the one that put me on Ursodiol, because my PCP at the time was not helpful. She was just not there. Patient speaks English. Patient is ambulatory and was accompanied by friend, which is my primary caregiver. Patient is otherwise in usual state of health and reports being able to walk a block or climb a set of stairs without shortness of breath. No smoking, no drugs. My drug history. Positive for malaise, fatigue, and weight loss. Negative for chills and fever. Negative for congestion, ear discharge, ear pain, hearing loss, nosebleeds, sinus pain, sore throat, and tinnitus. Eyes. Negative for blurred vision, double vision, photophobia, pain, discharge, and redness. Respiratory. Negative for cough, hemoptysis? I don't know what that word is. Sputum production, shortness of breath, wheezing, and stridor? Don't know that word either. Cardiovascular. Negative for chest pain, palpitations, orthopnea, claudication, and leg swelling. Negative for gastrointestinal. Negative for abdominal pain, blood and stool, constipation, diarrhea, heartburn, blah, blah, blah. Skin, positive for itching, negative for rash. Neurological, negative for dizziness, tingling, tremors, sensory change, speech change, focal weakness, weak, and headaches. I do not bruise or bleed easily. Negative for hallucinations and memory loss. The patient is not nervous, anxious, and does not have insomnia. Well, I do, a little. I am not in acute distress. Normal appearance, normal weight, is not ill appearing or toxic appearing. I thought that was interesting, toxic appearing. My head, normal, cephalic, and atraumatic. Right ear, my ears, external ears were normal, which they're called pinnies, the ears inside, but I'm not going to be that person. I just was. Nose, no congestion or rhinorrhea. I have a little congestion. Mouth, mucous membranes are moist. I don't know how I guess you can hear. I probably don't know. Oropharynx is clear. Okay. Here's where she's like, oh, conjunctiva normal. So she didn't really look into my eyes that much. Yeah, everything else normal. She really doesn't say anything. And she mentions here that there were no labs taken, and that's the thing that happened yesterday. There's not really much else to say about that visit. I didn't get a lot of impressions from it, except that she said that my body would be able to handle the surgery. But apparently I was meant to go in at 6 a.m. yesterday and get my blood drawn, which was not on my chart. Nobody said anything to me about it. And the only time I saw it was when the transplant coordinator handed me my schedule. And I was like, oh, wow. I did not have... And she even said, like, yeah, sometimes this happens. It's not a big deal. So I'm going to do my blood next Tuesday when I go back. Or we'll start a little early. Next Tuesday, back to my chart. Next Tuesday, I have CT, and then another, looks like a consult at 9:30. Oh, it's the nutritionist. That's what that is. At 9:30 is the nutritionist or dietitian or whatever whatever this one's called. And then the CT scan. And I think I have chest x-rays also on the schedule. It's not on my chart. So that will be on Tuesday. That'll be another all day. I don't know if I should just do a part 3 about the intake nurse. I only have 2 minutes left. Yeah, I think I'll do another part for that one. And then maybe another part with like a wrap up. So it's a big thing, but I will be right back.